again, at the end, really want to talk about the importance of public-private partnerships. The state's going to have to work with sister agencies to be able to enroll them with some motor vehicle agency, or go into settings where you're going to find those high-risk members. We talked about those high-risk members being people who have mental health, maybe, into those kinds of settings and engaging them at that point. There are no extra state dollars for engaging patients and doing the outreach. We've had lots of success in the state around New Jersey family care enrollment and looking at those practices, a lot of website education, looking at county outreach and community-based organizations to partner with. I was on the phone with someone just last week about putting navigators in strategic locations across the state so as to bring them into the program. It's going to require a lot of training because the rules are developing as we speak, and as the rules continue to develop, the training continues to evolve like any other government program. So we're going to have to be flexible, we're going to have to be open-minded, we're going to have great communication channels, we're going to have to start developing our network of influence and engagement right now in order to make this successful. It's only going to be as successful as the patients who come into the program. So in summary, this is going to be Medicaid, as we know, is an extremely critical program. At this point, it covers 60 million low-income and high-needy Americans with an opportunity to cover an additional 16 million. And the foundation is going to be critical in terms of reforming today so that it becomes a stable program. We can always talk about, is the entitlement what it should be, and are there opportunities for entitlement reform? That's another discussion, but in terms of how the system is today, we're going to have to act now. The challenges are going to be what we all know. States are really struggling from the effects of economic downturn, so there are issues with spending and having resources to make this successful. We see what's happening in terms of the federal budget and the deficits there. And then we have states that have very rigid and very limited timelines, and then resources aren't available. People aren't available. So you need manpower, you need resources, and those are not available. So what are the opportunities? The opportunities are looking at ways of reforming the system in collaboration with people who know it the best. We see a lot of movement around payment reform going. How can we bring that into the picture? The governor signed into law the Medicaid ACO, the Accountable Care Organization. How do we maximize that in order to help expedite that payment reform so that we're not paying for every patient that comes into a physician's visit, but we're paying in order to make sure that the patient's outcomes are the best outcomes possible. That's going to be extremely critical. We're also looking at a number of different opportunities around developing a new workforce, community health teams. New York State is working on something called health homes. We're looking at new models of care coordination and delivery. How do physicians and physician extenders work together? Are there new ways of seeing patients or reaching patients or getting to them? There are hospitals that are actually talking about developing things like EICUs. In other words, when you have an intensive care unit in a hospital, you don't have a physician there every day, but could there be almost like a command center where you have expert physicians sitting there and monitoring many different ICUs at the same time because you have all the parameters and metrics around. So things are changing as we speak. And this becomes an opportunity to look at what the innovation is around us and see what we can implement and bring together and create a culture where people want to change, people are able to talk to one another and come up with solutions. I'm always someone for doing micro experiments. So every little group should be able to do something that they think is going to work and truly get to the bottom line, and then see how we can scale that to a larger level based on metrics. So with that, this truly is great to see all of you here. I know it was a lot in terms of Medicaid, but it's such an important program. It's something that I feel very personal to because I worked in an FQHC, I work in a nursing home. I know that we as a society fail the most vulnerable if we don't come up with the right solutions. So thank you.